the US and they're talking about disruptions in the healthcare space. There's a lot of talk about telemedicine, these sort of, some of the initiatives they're talking about as well. Where do you see the opportunities and challenges here in our space first?
See, first of all, I think we need to look at the challenges in different ways, in the sense that, the primary healthcare challenges are totally different from that of the secondary healthcare or even the devices. Is this working? Yeah. We are focusing more on the primary healthcare area and also the diagnostic areas. We talk about the shortage of doctors. Yes, that's a real problem. But then how long can we sort of keep talking about it? I mean, there has to be more training, there has to be more doctors. But at the same time, there has to be some parallel solutions that need to be worked out. For example, I mean, if you look at the government hospitals, most of the doctors are in the district hospital. And for the smallest of the diseases, people actually visit the district hospital. They don't need to go there. I mean, 80% of the cases can actually be handled at the subcenter level or the PHC level. So we are not optimizing the distribution of the cases in a manner so that, the available number of doctors can be utilized properly. So one is that until and unless we have strengthened the primary healthcare system in this country, we will not be able to address the challenges that we are going to talk about. Coming to the innovation-related challenges, the innovators, who are the innovators? If you really look at the profile of the healthcare innovators, like in the social enterprise arena, this is individuals who have got brilliant ideas, need not have the management capacity, need not have the business acumen to actually scale it up. I mean, sometimes we find that they are very scale shy, okay? They're pretty happy, like, doing something. They've come up with a $5, glucometer kind of a concept. And where are they operating? They're operating in Bombay urban slums. It's a complete waste of an idea. I mean, if you can't sort of take that test at 5 rupees to the rural areas, then what's the point talking about a low-cost diagnostics? There are other challenges, like the government is still the biggest provider when it actually comes to the base of the pyramid. But if an innovator has to go and work with the government, there's a huge challenge. The procurement system is so complicated that it is virtually impossible for the innovator to go and sort of work. Funding is another very big area. Like, there's a lot of money available. You go to the government, they will say, we don't need money. There's lots of money. You go to the private sector, there's lots of money. But actually for an innovator to get money to address some of the firm level problems or creating the demand for their devices or to create the distribution channel that necessarily help the products or the devices or the solutions to reach the beneficiaries, it's very difficult because the kind of criteria that the donors, the development partners come up with are very, very unfriendly for those small innovators. So if you really look at it, we see challenges at 4 levels. One is within the company or the innovators. They have certain individual company-specific challenges. Like Om talked about the lack of medical, personnel. That's a huge problem. They go out to the market, there is a huge shortage. So where would they get those people from? Secondly, like, those who are available, they cost quite a lot of money. So as a startup, you won't be able to pay the kind of salaries that a doctor has to be paid, or any other paramedics that need to be paid. Secondly, like, once you get out of the system of the there's a value chain which is required to support the innovators, and that value chain is lacking. Third level is that this health-seeking behavior is very, very low. We don't sort of go for the preventive kind of stuff. Until and unless I'm sick, I will not think of the doctor or the hospital. And that's a big problem. More you go to the rural areas, more you go to the base of the pyramid, that is what is causing the huge problem. So the amount of money that needs to be pumped in to mobilize the people to come and seek services is much more than the actual cost of, developing those solutions and making it.
So they need to have access to those services. Absolutely. And when you're saying